tray fits first of all. The dentist normally does that. So once you choose your tray, you have to shake your adhesive, spray it on, not too close, just keeping it at a nice length. And then just let that dry slightly so it goes tacky. With your alginate, that's been in the drawer, so it all clamps together. So you should be shaking it, tapping down the lid so you don't get any alginate around the side, and then opening it. If it was a large tray, you could do 2 scoops. But seeing as it's a small tray, I'm doing 1 scoop. So compress it slightly, but not too much. Use the flat bit of your spatula to scrape off any excess and then put it into your alginate bowl. So because I don't want to waste materials today, I'm only using 1 scoop. So I'll put my lid back on and then I'll make sure I get some water. So you don't want your water too cold because it will make it set quick, and then you don't want the water too warm either. Because too cold will make it not set quick, and then too warm will make it set quick. So the easiest way is to measure it and then put it on the side, just so you know that it's on the correct level. So a little bit more out and more. If you hold it up in the air, it moves, so you don't get a clear indication. So just make sure it is on the number 1 scoop and then on the number 2 if you was doing 2 scoops. So you should be holding your bowl underneath, and then you tip the water in. So then you start to mix around, and again, that's going to need a little bit more water added. Sometimes the indicators are not correct. Do you find you need more, Sam, when you do it?
Yeah, I do it just a little bit above the line, to be honest.
These have changed from the last time I've mixed.
Yeah.
That's a better consistency. So you can keep tapping it on the side for now, and then just keep mixing it round until it's all mixed together. So when it's a consistency like this, you do need to do it quick, but then don't rush it so you don't get a good mix. So if you're loading the tray, always start from the middle and then go down to the sides. Wipe your excess off. And then you can just build it up a little bit more on the front. If you was doing an upper, I wouldn't build it too much up at the back as well, then that's ready to go in the patient's mouth. So then, once we've completed the impression, you should have had a bag ready and a lab ticket. So on the job ticket, you have to put the patient's name, whether they're male or female, because obviously the jaw is different, so when it goes to the technician, they can know whether it's male or female, and the teeth actually form different, male and female as well. The ear was for a denture. Then you put the surgery name and whether it's NHS, private, and then put whether it's a denture or there's a separate one for a crown as well. Once you filled out all the information, then that should go in a packet on the side. These gloves are clean, I'm just using them for this purpose only, but normally you do all this without your gloves on. So that's ready to go on the side, and I just wanted to show you then how we clean the bowl. So I always rip the tissues in half just to save on stuff. So when it's dry, you're best to just move it downwards to clear your spatula. Then with the same tissue, you can just go around the top. You don't need to disinfect the bowl because it's not being used in the patient's mouth. And then you just kind of push it all out. Never do it when it's wet because it gets in a right mess. It's a good idea to have 2 bowls as well if the dentist wants the upper one doing and then the lower. Okay, my bin's not working. So then that goes into the clinical waste bin. You can put your bin. Rinse your impression. So it needs rinsing, then it goes into a disinfectant bath. So you can buy the sachets or you can use 1% water, 1% bleach and then the rest water. I'm not going to make it up today, but that would go in there and then that would soak using the manufacturer's instructions on the back. It could be 1 minute, it could be 3 minutes, it could be 10 minutes, depending on the impression. So what you need to do then is wet some tissue, keep that on the side. When your impression has been soaking for the length of time, you then rinse the solution off afterwards, and then you wrap it up. Then that's ready to go inside the impression bag. You can remove your gloves afterwards, seal the bag, and then write it into the lab box downstairs. Okay.